What is it about some places that make us feel safe and welcome, and others that make us feel threatened, on edge, or like we don't belong? The places where we work, or play, or shop, or receive health care all affect the way we feel in that place and whether we want to stay or come back. And why is it that two people can experience the same place in completely different ways, even at the same time? For one, walking in feels like slipping into a warm bath, virtually indistinguishable from their world outside. But for someone else, the exact same thing could feel like cold water, cold, hard, and unwelcoming. Well, it can be in the warm smile or a sideways glance, someone offering to help or pretending not to see you, or a colleague advocating for you or trying to undermine you. When these things are negative, we call them microaggressions. But there's not really a good equivalent word for small, subtle, positive behaviors. And maybe these are the things that help spread joy in an organization. So how do you measure joy? What is joy? What causes joy? Is it stable? And is it the same for everyone? These are some of the questions asked to us at the Kern Center for the Science of Healthcare Delivery by the CEO of Mayo Clinic, Dr. Enrico Ferrugia. So in order to measure joy, we first needed to define it. And there are as many definitions of joy, especially in the workplace, as there are books out there claiming to know the secret of creating joy, of finding joy, of living joyfully. But what about specifically in a healthcare environment? And even more specifically, what about the patients and the employees of Mayo Clinic? So we started to answer that question by assembling an incredible team from very diverse perspectives and backgrounds, what we now call the Novel Measurement of Joy program. We put all of our heads together and came up with 4 distinct studies from 4 distinct perspectives. And there's too much to cover here, but we'll hit a few highlights. So first about me, my name is Dr. Sean Phelan. I'm a health equity researcher here at Mayo Clinic. I study the root causes of disparities in the healthcare experience, in interpersonal care processes, and in care outcomes for marginalized, stigmatized groups. Specifically, I focus on the idea of identity threat, or the way that an environment can communicate to us that we might not belong there. So how does a health equity researcher define and measure joy? Well, I've started a study where we're using diverse patients' and employees' cell phones to ask about their experiences, and in that moment, connect it to their emotions and feelings that we think might be important for joy, connectedness, meaning, and things like that.
I chatted with a mom and her daughter, and she told me that she was 5 years old, wheelchair-bound, and nonverbal. I'm sure, like a lot of you, I was taught as a child growing up to not stare at people with disabilities. But then the mom asked me a question, and she said, how would you feel if you went through your entire day and you didn't have one person look at you? The next week, a member of our research team observed a little girl in a wheelchair and felt really sad for her. But then as the girl went along, her wheels lit up in these bright, blinking colors. And something that made that girl different also made her unique and special in that moment. My name is Jennifer Smerdel, and I'm a service designer in the Kern Center here at Mayo Clinic. Our project looked at moments where we can see patients' emotions shift in real time and then measure those moments qualitatively. We would never have known that that mom and her daughter felt invisible without having sat down and spoke to them and heard their story. So looking at joy in the context of healthcare is not ice cream and balloons. It's these tiny moments that we can capture and measure and use to help us innovate and provide rich opportunities for our patients to feel important, supported, and visible.
I want to tell you a story about 2 physicians I know. Both of them are seeing more patients and spending less time with each patient. Both are trying to grapple with a new electronic medical record, and both have documentation challenges and a million other things stressing them out daily. One of those physicians is basically burnt out and doesn't know how much longer he can do this. The other one, on the other hand, he loves his job and is motivated by it. So what differentiates these 2 physicians? What can we do to help everyone feel like the second physician, joyful? When considering these two different perspectives in regards to increasing moments of joy in the workplace, we have to talk about the concept of safety 1, which is identifying what goes wrong, and the concept of safety 2, which is identifying what goes right. In understanding both concepts, we're able to hopefully hit the sweet spot in supporting joyful moments. I am Dr. Renaldo Blocker. As a human factors and ergonomics expert specializing in cognitive engineering, I would typically approach this type of issue from a system perspective, trying to understand how I can structure your processes, tools, and overall working environment to support your cognitive abilities. I will usually fall back into my trap of measuring workload using my validated workflow or work system tools and using data from a safety 1 perspective, which is identifying what goes wrong, to help me understand what is not bringing joy in order to hopefully create interventions to foster joyful moments. What we're doing is innovatively using wireless EEG devices to measure brain waves and associating those brain waves with positive effects using the circumplex model. And we have integrated design thinking in our process and health equity in the research design. With that, we're able to capture if an employee emotions during a task is more positive or negative. We hope that this study will help us identify ways employees can feel more joyful when they work and provide a methodology for tracking emotions over time. We also hope this study contributes to sustainable interventions. Joy is a complex concept, an emotion that we all recognize when we feel it, but struggle to define it. Any one of us could have taken a narrow view of joy and researched it and understood a part of it, but it takes a team of people with different perspectives to see and measure joy in totality. Thank you.
Thank you all.
Tom?
Thank you very much. You know, it was so interesting to hear this. Thank you so much. Is the idea of introducing joy, do you see this as being on the providers looking for the moment that they can have that interaction, or is it on the space, like having stuffed kittens in the corner or something like that? Is there a favorite? Anyone here? Jump in there.
I think all of it. I think all of the above. I mean, it's certainly on the provider, on the care team, the front desk staff, the greeters in the hallway, you know, everybody to try to create moments where people feel special, where people feel like they're in a place where they belong, where they're welcome. But that said, there's a lot I think we can do with the physical space to do the same thing with the artwork, with the flow through the space that makes people feel happy, like there's opportunities for them to enjoy their time at Mayo Clinic in the midst of maybe a really difficult time in their lives.
So there's no word for the opposite of microaggression. Have you thought of a word? Have you been brainstorming? Microjoy-aggression?
Microjoy, yeah, maybe.
Microjoys?
Yeah. Actually, I was worried that there was a word and I just couldn't think of it. So now afterwards, somebody's going to tell me.
Well, speaking of joy, Jennifer, now that you're done, I want you to be grateful that you did a great presentation, and now you can focus on getting married in 2 days. So congratulations, and thank you all for being here.